Dr. Vella,
Yes.
today,
Yes.
here on the Beverly Hills Plastic Surgery Podcast,
Yes.
and I'd like to welcome everybody here, we are going to talk about transgender rhinoplasty.
Yes, we are.
This is a difficult topic.
This is difficult. This is like the tuberous breasts of rhinoplasty.
It is. That's a good analogy. This is something that I think I feel like we have to do a separate, I know we did a facial feminization podcast, but I think that we have to take rhinoplasty and really look at it, especially in the facial feminization population, as a very separate procedure.
It's very separate because the goals are very different for this population, because it's not a man coming in asking for his nose to look stronger or more lifted or straighter. This is someone coming in asking for their nose to actually look more feminine.
Right. And in the transgender sort of milieu of operations, typically in a male to female transformation, the rhinoplasty is lumped in with the facial feminization procedures, which I think causes a fair amount of problems.
Right. It's considered part of the bony structure of the face, and the bony structure is usually addressed all at once in one procedure. So at the same time as the patient is getting a forehead reduction and a jaw reduction and a chin reduction and all of the above, the bony work, then at the end of the case, they say, oh, and then we're going to do the rhinoplasty.
Right, which by that point, you're exhausted.
Tapped out.
You've been there for 6-7 hours.
Yeah.
And I just think that, you know, unless you have, like the way we do it, where there are two of us and we're, you know, sort of going gangbusters and we each have our own little part of the play to do, you know, and then the rhinoplasty comes and I can, like, you know, get down on that rhinoplasty.
Yeah.
It really makes it hard. And I just think that and the reason that I wanted to talk about this is because I've seen now a fair amount of not great facial feminization rhinoplasties.
Yeah, I've heard that. I've heard that there's a decent amount of revisions out there, probably more so than many of the other aspects of facial feminization. And I think it's because, and I could be wrong here, but rhinoplasty on its own is a very specialized procedure. And the surgeons that do it and that do it well tend to do a lot of rhinoplasties, and that's sort of their thing, and it's their niche, and it's what they do. But a lot of times, the same surgeons that do facial feminization procedures aren't necessarily rhinoplasty surgeons. They're oral surgeons or ENT surgeons or people who do face work, but maybe they don't specialize or haven't specialized in the past in rhinoplasty. So I think that's where the rhinoplasty sort of gets lost.
Exactly. Rhinoplasty is a very specialized procedure in and of itself on anybody, let alone in the transgender population. And I think that you want to, I really think it should be kind of separate and distinct from the rest of it, either having the guy that does that as part of the facial feminization procedure as we do it, or doing it on its own.
Yeah.
Maybe getting all the other sort of aspects of the facial feminization performed maybe once, doing maybe a bony brow reduction, doing, you know, whatever, putting in some cheek implants or reducing cheeks or reducing the jaw, whatever else you want to do, fat grafting, doing a tracheal shave. All these things can certainly be done in one shot, but I don't think you then go, oh yeah, and let's just like take care of the nose.
No.
It's just not that easy.
No, you really sort of got to nail that one. So when you are talking to a transgender patient and they come in and they're requesting a more feminine nose, how do you approach that? What does that mean to you? Sorry, my ring is going off.
That's all right. Well, there's a couple of things, you know, and we'll get into revisions in a second, but I think, you know, here's what it's all about. And it's not the hokey pokey. You have to understand